Hello and welcome. So today I'm going to talk about our perineum. As I already introduced you in my earlier part of video that the lower part of the pelvic diaphragm or pelvic floor is known as perineum. So it is basically a diamond shaped space as you can see in this photo, and the actual boundary is anteriorly you're going to find lower border of the symphysis pubis along with the arcuate pubic ligament. Posteriorly you're going to find tip of the coccyx or coccyx bone. Anterolaterally you're going to find ischiopubic rami along with the ischial tuberosity, and posterolaterally you're going to find sacrotuberous ligament and gluteus maximus muscle. Okay, now an imaginary horizontal line connecting the anterior part of the ischial tuberosity. Okay, and for this you are getting an anterior triangle and posterior triangle. Okay, now the anterior triangle is known as urogenital triangle and the posterior one is known as anal triangle. Okay, now I'm going to talk about today's video anal triangle. So this is the topic. Now this anal triangle is basically present in the midline of the perineal body, and it contains anal orifice or anal canal, which is surrounded by the sphincter ani externus muscle along with the anococcygeal raphe. Now this is the basic part. On each side you're going to getting Ischiorectal fossa. So this is very important topic to understand that it is a wedge shaped space both sides, presents in between the lower surface or the inferior surface of the pelvic diaphragm and the pelvic surface of the ischium bone. Okay, now in the measurement it is actually vertically 5 cm, anteroposteriorly 5 cm, and laterally or transversely it is 2.5 cm. That's it. Boundary of this ischiorectal fossa, laterally you're going to find obturator internus muscle, obturator fascia, and ischial tuberosity. Okay, medially you're going to find liberator ani externus muscle, sphincter ani externus, along with the anal fascia. Anteriorly you're going to find transverse perineus superficialis muscle, and posteriorly you're going to find sacrotuberous ligament along with the gluteus maximus muscle. Now the apex is formed by the anal fascia and obturator fascia fusion, the fusion point of the anal and obturator fascia, and base is formed by the skin and superficial fascia. And now the recesses of this ischiorectal fossa. Recesses means extension of any gap area. So it's basically it has two parts: anterior recess, posterior recess. Okay, anterior recess is basically it's an extension part along with the pubic arch and above deep perineal pouch, presents in between pelvic diaphragm and urogenital diaphragm. That's it. The posterior recess is basically is an extension point in between the sacrotuberous ligament, sacrospinous ligament, and the coccyx bone. Okay, now this ischiorectal fossa is associated with lunate fascia. Basically this fascia is actually arch manner or a crescentic moon shaped. Laterally it joins with the obturator fascia and medially joins with the anal fascia. Arch fibers laterally blends with the periosteum part of the ischial tuberosity, and it medially blends with the Hilton's line. And now this ischiorectal fossa is also related with the Pudendal canal. This Pudendal canal is also known as Alcock's canal. It is basically a fascial tunnel, a tunnel made by fascia, presents in the lateral wall of this ischiorectal fossa and almost 2.5 cm above to the ischial tuberosity. It extends from the lesser sciatic foramen to the posterior part of the deep perineal pouch. Now the contents is basically the internal pudendal vessels along with the pudendal nerve. That's it. Now this entire ischiorectal fossa has three segments. First of all, suprategmental space. Second of all, ischiorectal space. And third of all, perineal space. Now overall contents of this ischiorectal fossa you're going to find first of all internal pudendal vessels along with the pudendal nerve, then inferior rectal vessels and inferior rectal nerve, then in male you're going to find posterior scrotal vessel and posterior scrotal nerve. In female you're going to find posterior labial vessels and posterior labial nerves. Okay, then perineal branch of fourth sacral nerve along with the perforating branch of second and third sacral nerve, basically a part of sacral plexus. Okay, along with the you're going to find a pad of fat. This is all about our anal triangle. and in my next video I will talk about urogenital triangle. So till then, bye.